Hello, guys. How are you guys doing? It's been a minute. It's been a while. Um, if you have been judiciously following my channel, you probably would have noticed that I haven't posted a video in quite some time. Why was that? Essentially, I took a little break. It's important that we give priority to other things that are happening in our lives as well. Okay, but I'm here, I'm back, and I am better. Okay, so someone actually asked me a question. Um, Someone asked me a question. What is fibrocystic breast disease? So, what is fibrocystic breast disease? So I received that question and I decided to make a video about it. You know what we do in this channel. We talk about health and we talk about politics because those two, in my opinion, uh, they are inextricably connected. Okay, so let's get right into it. What really is fibrocystic breast disease? What is that? What is that? And before I get into this, I just want to make it clear this is not a medical advice. Okay? If you have any breast issues, I recommend that you consult your provider, your PCP, your primary care provider, your doctor. Okay? But this is for educational purposes. Okay? So, what really is fibrocystic breast disease? What it is how do you know that that you have fibrocystic breast disease? So usually this is a breast mass, okay, that changes in size and it fluctuates, okay, based on menstrual cycle. Okay, it's usually painful, and typically the pain will radiate to maybe the axillary part of your breast. Okay, so of course this happens. Typically, we see this in women. Um, so if this is happening, you might see or notice that your breast is full. Okay, and you might even get maybe a discharge. Okay, occasionally you might have just a little greenish brown nipple discharge. Okay, and usually your provider or whomever you see for your breast examination, they might do an ultrasound. Okay, so that's pretty much what it is. It's a breast mass that is always changing in size. Okay, especially during your menses. Okay, and you tend to feel it more before your menses. Okay, so that's just in the most simple term. That's what fibrocystic breast disease it's all about. Okay, so um, again, it's not breast cancer. It's important that I say that because sometimes you might palpate your breast and you feel something. The way the human mind is, we always run to the most negative diagnosis that we can figure out in our head. So fibrocystic breast disease is not breast cancer. It is non-cancerous. It is benign. Okay, Um, so again, what are the symptoms that are typically associated with this? You can feel that you tend to it tends to be painful. It tends to have breast tenderness, and it's pretty it can be bothersome, right? Especially before your menses, and it usually resolves at the beginning of your menses. Okay, so those are the things we typically see with fibrocystic breast disease: pain or tenderness, and you feel like a lumpiness. Okay, sort of. But again, it's not. I will get to what really makes it different from breast cancer, okay, or breast carcinoma. All right. So, in which age bracket do we normally see fibrocystic breast disease? Okay. So typically we see that in women who are between the ages of 30 and 40. Okay? It doesn't mean that it's restricted to that age group, but that is the typical age group, okay, where we tend to see this particular disease. All right? So I mentioned this before. Again, it's important that I really clear this up. What makes it different from carcinoma, right? What makes it different from breast cancer? Typically, cancers are not painful, okay? But fibrocystic disease is typically painful, okay? The size is the size can change. There's fluctuation when it comes to size. And you tend to see multiple lesions. Okay? Typically, cancer does not come like that, right? Breast cancer is typically a hard, firm, fixed nodule that is painless. Okay? And it, it has all the A, B, C, D of cancer. Okay? Irregular border, right? It's different colors. Okay? And just grows, continues to grow. In the case of fibrocystic breast disease, it's painful. Okay? The size fluctuates and it's multiple lesions. So it's different from carcinoma of the breast. So now you establish that someone has fibrocystic breast disease. The question is, what do you want to do next? Right? What is the recommended treatment? So the first thing you want to do is it's important to avoid things that will stress the breast. Okay, you want to avoid trauma. You want to avoid like tight fitting clothes, tight fitting bra, things that will really upset the areas of the breast. Okay, and if those conservative measures do not work, okay, then we can look into doing combined oral contraceptive agents. Okay, but again, that is we that tends to happen as the severity progresses. So you do the conservative part and it doesn't improve, then at that point they can look at getting the patient to do some combined oral contraceptive agents to reduce the seriousness of the disease. Okay. So, again, another question that I got was, so one of the ways it's really important that as a woman you be on top of any changes that happen, right, on your body. And typically women are very good at this, as opposed to men. We tend to be a little bit more negligent, okay, when it comes to what's happening in our body. But women, for the most part, stay on top of it. So when should a woman perform monthly breast exam? Okay, when is the best time? I guess that probably will be the best way to phrase that question. So it is important that as a woman you do monthly breast examination, self-examination, right? Just to be on top of what's going on in your body and as it regards to your breast. But when you're doing the monthly self breast exam, right? I'm not talking about the one you go to your clinician to do, but the self breast exam. What is the best time to do that? The best time you want to do the monthly self breast exam is about 1 week after your period, about 1 week after your menses. Okay? And why is that important? Okay? Why is it important that the timing, why is the timing important? So the timing is important because during your menses so many things are happening, there are so many changes happening with your breast. So you want to wait after your menses to do the monthly self breast exam, because that's when the cysts, remember this is fibrocystic, the meaning is in the name, right? Those are when the cysts are at their smallest. Okay, because you don't want to do the exam when you're having your menses. So like I said, there are so many changes happening in your body. You might confuse some of the findings. Okay, some of those changes, you might not be the best time to appreciate some of these changes. So really the best time you want to conduct this self breast exam is a week after your period, because that is when some of these cysts are at their lowest. Okay, so yeah, I'm gonna be churning out videos like this, educational videos, that are just meant to provide and instruct people about how to handle their health situations and health condition. Like I said, someone asked me a question, and I decided to make a video about it. And some of these things you never know. Someone somewhere is having this problem. Like I said at the beginning, the psyche of human beings is such that whenever we feel anything on our body, we jump right to the most severe disease we can think of. Oh my God, I'm having a breast cancer, right? But the truth is, there are other things that could have similar presentations as breast carcinoma, but they are not breast cancer, right? You have fibroadenoma, you have breast abscess, you have mastitis, you have fibrocystic breast disease, right? So there are tons of things happening in the breast, especially in the breast of a woman, that it's important that we are able to make some of these distinctions so that you can be able to sleep well at night, okay, and not develop hypertension. So watch out for my next video. If you already haven't subscribed, you need to do so. Okay, this channel, like I said, is to provide you critical information about how to stay on top of your health, I am a strong believer that the decisions we make are contingent upon the quality of information within our disposal. Okay? And yeah, that's what this is about. Thank you once again. I appreciate your support, your like. NZTV. Stay blessed. Bye.